Glioblastoma is also referred to as a grade 4 astrocytoma. It's a fast-growing and aggressive brain tumour. Chemotherapy and radiotherapy can boost cancer stem cell production and actually accelerate a patient's death. Where chemo and radiotherapy treatment fails, turmeric was able to keep up its cancer-fighting effect. Hence, this is why turmeric extracts may beat the conventional therapies in the treatment of one of the most lethal forms of brain cancer. One research team analysed a total of 19 test tube and 5 animal studies regarding the effects of turmeric extracts and their ability to fight or prevent glioblastoma. They concluded that curcumin could inhibit the cancer cell growth and induce cell death in certain subpopulations of glioblastoma tumours, making it an attractive therapeutic agent which could be considered as a potent anti-cancer treatment. Though the study had its limitations and further research would be needed to address the bioavailability issues in humans and to find the ideal dose, another study published in the journal Nutrition and Cancer discovered that it's possible to get bioactive dose of curcumin into human glioblastoma cells via oral delivery methods. From my research, a dose of 5 grams of curcumin extract should be taken daily. Its bioavailability can be increased in many ways, such as with a meal containing fat. In India, it's traditionally fried in coconut oil, and it's taken also with black pepper extract or bioprin. Different epidemiological studies have shown that the disruption of normal circadian rhythm is implicated in increasing the risk of developing cancers. In addition, deregulation of expression of clock genes has been demonstrated in various types of cancer. These findings indicate a close association between circadian rhythm clock and cancer development and progression. Glioblastomas are highly lethal cancers containing self-renewing glioblastoma stem cells. It was shown that these stem cells differentiated the glioblastoma cells and the non-malignant brain cultures, and they all displayed robust circadian rhythms. Yet, these stem cells alone displayed exquisite dependence on the core clock transcription factors for the optimal cell growth. So the down-regulation of these transcription factors in the glioblastoma stem cells would induce cell cycle arrest and apoptosis. This brings into question whether the disrupted sleep cycle could be a primary driving force in the growth of brain cancer, and if an overstressed workaholic who has a disrupted sleep has caused or is worsening their condition, partially as a result of the disrupted circadian rhythm. SR 9009 was developed by the Scripps Institute as a cure for jet lag. In one study, SR 9009 also reduced the growth of glioblastoma brain cancer, and it lengthened survival time in mice with glioblastoma tumours. It worked about as effectively as thiazolamide, the current standard treatment for glioblastoma, but it did so without any apparent side effects. Thiazolamide often causes hair loss, gastrointestinal upset, and nervous system problems, among other effects. SR 9009 and SR 9011 both pass the blood-brain barrier, enabling them to reach the brain. This was administered as injections due to the questions on the oral bioavailability. However, anecdotal user reports attest to its benefits through the oral route, especially when it's dissolved in DMSO and taken sublingually. Small amounts of SR 9009 are needed regularly due to its short half-life, and it's also important, hence the timing and the dose protocol, so it should be taken every 2 hours. When evaluating the influence of a concomitant administration of the pineal hormone melatonin in patients with glioblastoma who were treated with radical or adjuvant radiotherapy, in a study including 30 patients with glioblastoma who were randomized to receive the radiotherapy alone or the radiotherapy plus the melatonin at 20 milligrams per day orally until disease progression, both the survival curve and the percentage of survival at 1 year were significantly higher in the patients who were treated with the radiotherapy plus the melatonin than in those who were receiving radiotherapy alone. Moreover, the radiotherapy or steroid therapy related toxicities were lower in the patients who received the melatonin. The resistance of glioblastoma to conventional therapies lies in subpopulation of cells called brain tumor initiating cells, where the metabolic profile is highly dependent on aerobic glycolysis. Thus, a potential method to fight glioblastoma is by manipulating the metabolism of these cells. Reports have shown that high melatonin concentration displays oncostatic and chemoprotective adjuvant properties in several malignancies due to an increase in mitochondrial oxidative phosphorylation. Moreover, no side effects have been reported as a consequence of melatonin. All forms of cancer increase their growth rate when sugar is consumed. The metabolic profile is highly dependent on aerobic glycolysis. This is where insulin-potentiated chemotherapy may be beneficial. But at least a sugar-free ketogenic diet can slow the progression and allow for extra time for other therapies to take effect. Metformin treatment inhibits the motility and the invasion of glioblastoma cancer cells. A natural alternative in effectiveness to metformin or glucophage, the drug that's used to treat diabetes and for life extension purposes, is the herb berberine and the extract berberine hydrochloride. Berberine can reverse the process of epithelial mesenchymal transition, a marker of tumor invasion. This work supports berberine as a putative anti-tumor agent targeting the glioblastoma cells. And berberine induces autophagy in the glioblastoma by targeting the AMPK-mTOR pathway. Standard dose of berberine hydrochloride is 500 mg per meal with breakfast, lunch and dinner for a total daily dose of 1500 mg. In February 2007's issue of Nutrition and Metabolism, researchers report that in contrast to brain tumor cells, which lack metabolic flexibility and are largely dependent on glucose for growth and survival, normal brain cells can metabolize both glucose and ketone bodies for energy. Ketone bodies are 3 water-soluble compounds that are produced as byproducts when fatty acids are broken down for energy in the liver and the kidney, and they become sources of energy for the brain and the heart. A study evaluated the efficacy of KetoCal, a new nutritionally balanced, high-fat, low-carbohydrate ketogenic diet for children with epilepsy, on the growth and the vascularity of a malignant mouse astrocytoma and a human glioblastoma. The adult mice were implanted with malignant brain tumours, and the KetoCal was administered to the mice in either unrestricted amounts or restricted amounts. The effects of KetoCal on tumour growth, vascularity, and mouse survival were compared with that of unrestricted high-carbohydrate standard diet. Results indicated that the KetoCal, administered in restricted amounts, significantly decreased the intracerebral growth of the tumours by 65%, and it significantly enhanced the health and survival, relative to that of the control group receiving the standard low-fat, high-carbohydrate diet. A glioblastoma multiforme 4 brain tumour is often called the Terminator by doctors because of its low survival rate. One patient was given a year to live after his diagnosis. However, after transforming his diet, his tumour began to shrink, and this year doctors say there's almost nothing left of the cancerous mass. The man decided to eliminate all carbohydrates, sugar and most fruit and vegetables from his diet. Instead, he filled up on more meat, dairy and fat. His game plan to fight the cancer is based on the principles of the ketogenic diet. Many people believe that following such a diet can help to fight cancer by cutting off the tumour's primary energy source, sugar. Of course, many mainstream medicine practitioners do not agree with this diet and insist that there's no evidence to support such a claim. However, the patient's existence and the diminishing tumour in his brain should certainly suggest otherwise. Along with the melatonin to help to sync the circadian rhythms, high dose of CBD before bed would also be advised. A daily dose of 200 mg per day could be taken. A study has shown that the CBD slows cancer cell growth and it's toxic to human glioblastoma cell lines, presenting a possible line of treatment. Findings from a new study examining human and canine brain cancer cells suggest that CBD could be an effective therapy for glioblastoma by the research that was conducted at the Colorado State University. Other alternative advice to sync up circadian rhythm is to walk barefoot to ground and neutralize positive ion buildup in the body. A grounding rod connected to an electroconductive mat attached to your bed can also help during sleep. This neutralizing of positive ions can also be enhanced by high doses of liposomal vitamin C for its electron donor capability. A device such as the SOTA BioTuner on mode 3 for 2 20-minute sessions each day may be of benefit, as this has Schumann frequency harmonics that helps to resynchronize the brain's circadian rhythm and normalize all neurotransmitter levels. Getting up when it's bright and going to bed when it's dark. Removing UV light interference at night, and remove any source of electromagnetic radiation, such as a mobile phone, from your room, and use blue light blocking glasses. The increasing instances of highly dangerous types of brain tumours in the UK shows the case of glioblastoma multiforme has more than doubled from 1995 to 2015. The authors of a UK study believe that widespread environmental or lifestyle factors, such as the increasing use of cell phones, brought about this startling rise in brain tumours. Cell phone radiation is also known to disrupt melatonin production and circadian rhythms. Ensure complete darkness in the room to not disrupt melatonin conversion. Prescription SSRI medication, which further interferes with melatonin production and circadian rhythm. These can often be unnecessarily prescribed to someone who's undergoing a stressful life situation, such as a cancer diagnosis. Glioblastoma, the highly malignant type of brain cancer that John McCain had, may be very difficult to treat, but it's inaccurate to say that nothing can help. Studies going back to 2007 show that eating raw garlic releases organic compounds that kill brain tumours. In fact, a study reported by the National Health Services in the UK showed that consuming raw garlic successfully killed glioblastoma. Overheating garlic will kill the beneficial compounds. The best way to get garlic's health benefits is by ensuring that it's chopped or broken down beforehand and consumed raw. It's a good idea to let it sit for around 15 minutes after crushing it so that the allanase enzyme can be released. This is what causes the brain-protecting organic sulfur compounds to form. Consume 5 grams or 1 teaspoon of L-arginine plus 5 grams of L-citrulline on an empty stomach, either each morning or evening. This could be sweetened with stevia, but not sugar. Arginine supports healthy immune system response to fight brain cancer. Neutrophils become desensitized to the persistent systemic inflammation, and they become less responsive to disease-causing agents. Cancer cells thrive in an inflamed cellular environment, and if left unchecked, it leads to destruction of healthy tissues and tumour formation. Neutrophils stop the immune response by secreting an enzyme called arginase. After they secrete arginase, commonly they die and they're excreted by the body. Researchers have found that patients with glioblastoma do not exhibit the normal neutrophil-mediated immune response, and the cancer cell grows and spreads unabated. Scientists from the University of Colorado Cancer Center found that T cells are critically dependent on arginine for activation and function. They were able to determine immune system response is not dependent on an increase in arginase, but rather the resulting lack of arginine suppresses the immune system. The researchers concluded that persistent arginase production from the neutrophils suppresses the immune system and keeps cancer cells from becoming immune targets. A phase 2 clinical trial of AT101, which is a pill made from a potent compound found in cottonseed, appears to overcome the out-of-control growth pattern of malignant cells. So far in the clinical tests, the AT101 from the cottonseed stopped the usual lethal brain cancer's progression in many of the 56 patients who were treated. Before the trial, the patients in the study had already undergone standard treatments, including brain surgery and chemotherapy, but their aggressive brain tumours had started growing again. The cancer research subjects were then given a treatment consisting only of the AT101 daily for 3 out of the 4 weeks. After getting this drug, some of the patients went many months without any new growth in their tumours.